To give you an update on our PUIs, as of 12 noon today, February 10, there are 262 PUI cases currently admitted in various health facilities. There are 48 PUIs have been discharged and are under monitoring. Meanwhile, yung mga tests na ginagawa natin sa RITM, 109 PUIs have already tested negative. And of course, we know that 3 tested positive for the 2019 nCoV. There are 202 cases pending results from the RITM. No? Talagang dumadami yung cases natin na pinapadala sa RITM itong last weekend, no? Over Friday, Saturday, and Sunday. And the turnaround time right now at RITM is 48 hours for the test results to come out. We are seeing a rapid increase in transmission rate of the virus globally, as you have probably been tracking, no, in the global news. In response, the DOH has strengthened its capacity in preparation for the possibility of local transmission. All DOH hospitals are equipped to cater to the influx of patients and are following strict infection control protocols to contain the virus. On the contact tracing, to give you an update, as of February 9, the Epidemiology Bureau, together with the PNP, CIDG, has identified all the 441 contacts of the first and second case. Ito yung couple natin, no, of the 29 nCoV ARD. Regarding the third confirmed case, a total of 224 or 56% of the 403 contacts have been traced. Ito yung third case natin na nakauwi na sa China, including co-passengers and individual contacts from hotels and hospitals. Currently, 147 contacts have been interviewed and were placed on home quarantine. 8 contacts with symptoms have been categorized as PUIs and are admitted for isolation and monitoring. So meron lang tayong nadagdag na 8. We'd like to just announce that later this afternoon or early in the evening, the DOH is going to launch our interactive online real-time case tracker. No? It's going to be very easily appreciated. Makita nyo yung map kung saan yung PUIs natin, and the number of cases will be changed immediately as they change from one category to another, from admitted, for example, to discharged, or kung naging positive or naging negative. You'll be able to see this at the nCoV tracker.doh.gov.ph. So please watch out for that.
Okay, thank you po, Undersecretary Eric Domingo. Now let's have questions, Janelle, and then Ma'am Trish.
Hi, sir. Good morning. Sir, I'd just like to ask, because there are international media outlets reporting that nCoV is already airborne.
Well,
Do we have any confirmation about that?
Yeah, I did ask for information on this from the WHO office, and they said that there's nothing conclusive about it at this time. It's still being studied by the World Health Organization, but of course, precaution is still to be taken. But until we're given any hard evidence, right now the WHO has not classified it as an airborne infection.
Okay. Sir, follow up lang. Yung doon naman po sa mga dumating na repatriate nitong Sunday, how are they doing? May PUI ba tayo coming from those who arrived this Sunday?
So all of them were examined before they boarded the plane. They were monitored on the plane and then examined again upon deplaning before being sent to Clark, sa New Clark City, and they've been monitored including this morning. So regular yung twice a day checkup nila, and so far none have shown any symptoms. Walang fever, cough, or colds.
Janelle?
First po, updates on the first case. Diba last week you mentioned that the first of the second round of test results already tested negative. So yung second results po ba negative na rin? And second question is, update po on the PUIs who refused admission. Was the DOH and PNP able to convince them, or ano po yung fina-follow natin na measures to be able to convince them to get admitted?
We're still about to get reports on the ones who have not been admitted. So we will update you on that on Wednesday. But for the first case has already tested negative twice and has in fact been discharged. Christine.
Yes, ma'am.
Thanks, sir. Follow up dun sa first case, discharge, nakalipad na ba, sir, back to China or nandito pa siya?
Oh, I don't know kasi once, I'm not sure. But the patient was discharged on Saturday, I believe. Because yung last test niya done on Thursday or Friday turned out negative, and that was the second negative test.
Sir, yung definition lang ng code blue, anong ibig sabihin nun for the region and paano sila magpa-prepare?
So when we say code blue, it means that half of the workforce, the health workforce, are on duty at any given time, and that we are ready to mobilize more if needed. This is really in response to the, of course, very unlikely eventuality that somebody would get sick doon sa mga naka-quarantine natin, and nakabantay din kasi we're also trying to help decrease the anxiety and the fear of the community. So we want to deploy some health workers in the communities a few kilometers away just to check on them and keep advising them.
Sir Rafi.
Yusek, Dr. Rabi has been clear in saying that it's not right to compare the numbers between SARS and nCoV, but we have seen that in just the span of 3 months, the statistics of nCoV has surpassed the 1-year statistics of SARS. So how can we reconcile this, sir? WHO is saying that it's not right to compare, but then we have this statistics going overboard.
Yeah, but I think the stand of the WHO here is it bears some reflection kasi talagang when SARS happened, it was not recognized immediately and it was not sequenced within 2 weeks in the same way that this nCoV 2019 was sequenced and diagnosed immediately. So the timelines are completely different. Now, when we started recognizing SARS, we're probably a few months off na. As opposed to, for example, the nCoV 2019, when on the second week, we were able to diagnose them and identify the cases. So we really don't know yet how it will play out in the long term, but I think what's still clear is that even if we are gonna get more cases, this is still the fatality rate is still a lot less, no? Because of the recognized cases, mortalities go down to 2%, no? As opposed, for example, to SARS, where you have mortalities up to 10%. But of course, we're going to have to wait for a few more months to see up to where, to the extent of the spread of the infection will be.
But we're clear that it's highly infectious.
Well, that's not a term that WHO still, they don't have enough data right now to say that it is more infectious than the other diseases. No, parang the infection rate is still not as high, as other diseases. So they're not ready to make that conclusion.
Aiko?
Yusek, clarify lang po yung 5 chosen hospitals to monitor the quarantine facility. So doon po manggagaling yung mga health staff and health facilities para sa mga repatriates po natin.
Sa ngayon, JP Lingad, yung health staff, kasi ito yung pinakamalaking hospital natin within the vicinity. So the JP Lingad staff are the ones who are there monitoring the cases. In case lang we have to admit maybe more than 2 or 3, that's why we have those other hospitals ready, so that we have isolation facilities. But the lead medical center for this case is JP Lingad.
But just to let the public be informed po, kahit anong ospital, pwede po silang magpa-check, either private or public, to let them know kung mayroong halimbawa sintomas po sila ng coronavirus infection.
If they have symptoms, they can go to any hospital. And any hospital, of course, second level, third level would have the capability to manage them and admit them if necessary. Kung wala namang symptoms, there's really no need to consult.
Follow-up lang po on the PUIs po, Yusek. Meron na po ba tayong mga bagong regions na may PUI cases po as of this moment? Kasi may mga lumalabas na news. Although hindi pa consolidated sa DOH, may mga kiniklaim po silang may PUI sa regions po nila.
Well, actually kasi lahat ng regions meron na, Region 2 is Region 5, I'm sorry, Bicol region is the latest one without any, but all regions have at least one.
News 5.
And you will be able to see this in the tracker later when we put it up.
Sir, can you confirm, meron daw pong mga naka-admit na PUI and PUM sa V. Luna Hospital?
I'm sorry, I don't have that much detail right now. Maybe we can check it for you later.
Ma'am Sheila?
Sir, are you in close coordination with the Private Hospitals Association? Kasi like PHAPI is saying they can handle cases now, mga consultation, but when there's local transmission, hindi na nila kaya. Like one hospital now, may mga 1 or 2 isolation rooms, good for 1 or 2 patients.
Yeah, that's why yung field implementation team natin right now is mapping all the isolation facilities of all hospitals, not just the government and private. Because, of course, there's very few hospitals that would have a lot of isolation rooms like San Lazaro or RITM because these are specialized infectious disease hospitals. So most hospitals would probably have 1 or 2. And we will have to refer to those that would have room in case that we have a greater number of cases. Although the directive of the President for the regional hospitals and the government medical centers is to identify already possible wings or buildings within the hospital complex that will be dedicated to these cases in case the number increases.
So may mga assistance ba? Like mga supplies sa mga private hospitals?
No, the private hospitals, yung PhilHealth reimbursement pupunta doon, and of course yung usually may health insurance kung may health insurance yung patient. Sa government hospitals, the DOH to the CHDs do support the government hospitals including LGU hospitals.
Sir Jovi?
Sir, in terms lang dun sa stocks natin ng face mask for our health workers, kasi sinasabi ng WHO over the weekend na yung global stocks nag-deplete na and insufficient na. Ano yung status for our health workers dito?
Sa atin naman meron nag-deploy na rin tayo ng supplies right now ng PPEs, including N95 masks and hazmat suits. So far naman kasi talagang we've only had 3 confirmed cases, no? And of course yung mga highly suspicious PUIs, maybe talagang very, very limited ang stocks natin. And we're concentrating them only in the medical centers that have admitted cases. The department is having a meeting right now with the supplier for N95, yung 3M, to see how we can collaborate to bring more stocks in or if they can donate some to us. But there's also this move now in Congress and the Senate to approve the supplemental budget of 2 billion pesos. And that will be used really in particularly to buy protective personal equipment para siguraduhin natin na pag dumami yung pasyente that we have enough supplies.
So for now, yung supplies po natin is enough for
Yes, for
how
now,
many weeks pa yung...
kasya pa naman. Ang tingin natin it will last for a month kasi we distributed it all over all the regions. Meron naman tayo pa but we will need to secure in case we get more patients.
For the public use, ano ba talaga yung directive ng government? Because DOH is saying na para dun sa mga healthy, hindi naman kailangan ng face mask. Pero si LTFRB ang sinasabi ay dapat lahat ng drivers merong face mask and they face penalty kapag hindi sila magsuot.
Well, yung driver, yung kasing the usual public us, no, walking around, for example, in the outdoors or in the mall, or working in an office that's not too crowded, pwede talagang hindi mag-face mask. But we always advocate if you go into a more crowded area, di ba? And that includes yung siyempre yung mga public utility vehicles. Siyempre yung halimbawa sa LRT, MRT na siksikan, tapos may umuubo, then it might be useful to wear a mask, of course, with your strict hand washing regularly. Yung drivers, personally, siyempre yung drivers, ang exposure niyan is to a lot of people every day, no? Kasi tuloy-tuloy naman yung pasada niya. And it might be prudent, it would be prudent for the drivers to use a mask to protect themselves and also kung may sakit siya para hindi niya mahawa yung kanyang mga pasahero.
Sir JR?
Sir, good afternoon. Sir, yung sa, may mention po kanina sa Malacanang, yung sa Taiwan daw po, inclusion ng travel ban. Can we get further details po on that po? Ano na po yung status ngayon?
Yeah, ang Taiwan, if you look at the WHO map and the number of cases that they have, Taiwan is included in China, no? So since we have a travel restriction, a temporary travel restriction and ban on China, then Taiwan is included.
Is included, sir.
Is included. Yeah.
So, ibig...
Yung resolution kasi ng task force and even I think the presidential proclamation says China. And as far as the World Health community is concerned and WHO concerned, Taiwan is part of China.
Pero sir, yung implementation nun, sir, hindi pa po ninyo sinama yun before. Yung naunang mga araw na.
Nagkaroon ng confusion ng mga naunang araw, but I think as you all know, over the weekend na full implementation na.
May mga nagbakasyon po ngayon, sir, sa Taiwan.
Well, in the same way that what happened to we're still accepting flights from China and we're letting people down if they are Filipinos or permanent residents.
Sir, yung ano po, are you in the talks or is it in the pipeline to have a second batch of repatriation? Because
Not right now. I don't think there's any plan right now. The interagency task force is set to meet on Wednesday, and I think those are two topics that they will discuss, no? Yung siguro possible repatriation and of course some yung sa nuances nung ban to sa China.
Okay. Yun po sa report na may 4, may 5 na daw po na in total yung mga nag-positive po doon po sa na Pinoy po doon po sa Diamond Princess cruise ship. Ano po yung ginagawa natin coordination po?
Ang rule kasi is that if a boat, no, itong cruise ship, for example, is in your waters and there are people sick, the country that yung territory ng country na yun, the country will take care and manage those who are sick or injured. So in this case, all of them are now in Japan and being treated. In the same way na kung magkaroon ng aksidente, halimbawa ang barko, tas nasa Philippine waters siya, tayo obliged tayo na gamutin at magbigay ng medical care.
Icon, Janelle, then Ma'am Sheila.
Yusek, regarding lang po dun sa mga naiwan po na Filipinos doon sa Wuhan City, first report was 56 pero ang nakauwi lang po is 30. Do we have any reasons po or natanggap na information why they backed out sa pagbiyahe po?
Yung iba daw nagbago ng isip, no, and they decided to stay, and some of them naman have families already in in China na hindi Filipino citizens. Ang natin kasi, ang ating policy, ang makakabalik lang from China and territories would be Filipino citizens coming here. So some of them opted. But ang report natin is that nobody came to the airport showing signs and symptoms and was barred from taking the plane. Lahat ng dumating were healthy and were allowed on the plane. Those who stayed decided to stay.
Meron pong last week po yung sinabi ng Kappa Starlock na kapag ka daw po may second batch ng repatriates from Wuhan, they would still oppose on it. Ano na po yung measures ng DOH? Although kayo po yung lead agency, wala naman po sigurong jurisdiction ang municipality of Kappa Starlock, whether that happens.
Well, what we're doing now is really making sure that to show them that there's no risk for the community. This community is very, very far, and I'm sure they witnessed how it happened, how the disembarking, and then yung transportation from the airport to the facility. Talagang wala namang way na mag-expose ang anybody. And of course now, the facilities being manned by a team, and we're also having people, we want our medical workers to go around the communities to assure everybody that there's no risk. And wala pa naman at this time any plan for a second repatriation.
Janelle?
Yusek, is it accurate to say that the first and third confirmed cases have recovered for 29? And
Yes, they were positive at the start and then negative by the time they were sent
okay, so
home.
they've recovered, no
They've
symptoms.
recovered and cleared the virus.
Okay, and also, yung tungkol po dun sa Taiwan ulit, medyo magulo. Kasi sabi po kanina sa the laging handa briefing at Malacanang, it's still being discussed and it's a resolution that will be decided by the end of today.
I think they're calling the interagency task force on Wednesday. I believe that there's some parang Taiwan's asking for some reconsideration, no? Unless if they give proof to show that there's some safety, then siguro yun yung i-discuss. But as of now, as a part of the restriction of travel from China, Taiwan is included.
But then you said that there was some confusion at first. So when did we start imposing that ban on Taiwan as well?
I believe late last week.
Late last
Oo.
week. Okay, so it wasn't part of the initial, yung unang
Yeah,
request
oo,
na-
oo. Parang yung iba naguluhan yung ibang authorities. If they were, I think you know, no, that some flights were able to come in. But itong by late last week, it was cleared that the policy is that Taiwan is included.
By naguluhan, sino po yung naguluhan? BOQ, BI, or...
Parang lahat. No?
Okay.
Oo, oo.
Okay, but as per DOH, talagang kasama ang Taiwan.
Yes, kasi when we ask WHO very, very clearly, they always refer to just one China, no?
Yeah.
And Taiwan is included, even in their official reports.
Okay, okay.
Sir, clarification, kailan mag-i-start yung implementation ng ban sa Taiwan? After the task force?
Hindi, ngayon, kasama na siya sa ban ngayon.
As in, kailan po nag-take effect? May mga na-restrict na pumasok?
Yes, I believe since Friday, Saturday, Sunday, parang nagkaroon na ng mga restrictions and especially ngayong yung Sunday and Monday.
Just want to ask if this inclusion in the ban will still be subject to change, I mean, pending the meeting on Wednesday?
No, I think there's some data that Taiwan wants to submit and some protocols that they are doing and might be considered on Wednesday.
So it's not final yet.
It is enforced now.
Sir, yung mga passengers from Taiwan will also undergo quarantine po ba?
It will be exactly the same, no, as people coming from China, Hong Kong, or Macau, no, and Filipinos coming back are the only ones that will be allowed in. Filipinos and permanent residents.
Sir, linawin ko lang yung sinabi niyo po kanina na sa halos lahat ng regions may mga PUIs na po, except for Region 5.
Hindi, meron na rin sa Region 5. I think that's the latest one to get PUIs. Bicol has 2.
Ano sir yung pinakamarami po na region?
NCR pa rin. It's really the National Capital Region with 105. And this is followed by Central Luzon and Calabarzon, yung malapit sa atin. Of course, also near NCR. And then Central Visayas and Western Visayas.
Sir, basically, ano po yung, paano po sila kinonsider na PUIs? Paano po yung naging contact nila with...
So, the majority of PUIs now are really Filipinos, no? Initially, these were travelers. Nung first few days, if you remember, most of them were travelers from China who came in with symptoms. But now, more of the PUIs are Filipinos. These are Filipinos who have come in contact with the known cases, either sa plane, sa hotel, or sa hospital where they are admitted and have shown signs and symptoms of fever, cough, and respiratory illness.
Ma'am Boradjo?
Good afternoon, Yusek. Meron po bang reaction ng DOH kasi meron pong interview kanina kay Tarlac Governor Susan Yap na sinabi niya hindi daw po na-consider yung presence ng LGU nung may meeting ang DOH nung Friday regarding sa mga darating na repatriated Pinoys from Wuhan.
Yeah, well, I think naman the Secretary has made an effort to reach out to the LGU and to reassure them na although we are thinking, of course, of the national interest, but the interest of the local government unit will be taken into consideration in all of our preparations. We will make sure that there's no risk to the population of Capas and Tarlac as a whole, and that we will continue monitoring and make sure that there's no risk.
Thank you po. Sir Rafi?
Sir, 2 questions lang. Number 1 yung sa Taiwan. So it's just to clarify, it's enforced now, but after meeting with people from Taiwan, you said that they will still present data.
No, I don't think there was a meeting. I think they've sent
okay.
an intention to parang mag-appeal, no?
So,
but as of now, there's none.
So there is a possibility that it may change pa rin?
Well, the ban is temporary for all countries, no? It's temporary for China, Hong Kong, and Macau. And it is continuously being discussed at the IATF. So it's not a permanent ban. No, it's a very temporary restriction and ban on traffic, air traffic. So every time they meet, they reassess the situation, and it can of course be changed for the countries.
Okay. Sir, yung update dun sa disposal of the body of the second PUI who perished.
Second, alin yung second PUI? I'm sorry, I'm not I have to ask. Maybe I can update you on Wednesday. Ito yung patient sa yung second patient who died of pneumonia, no?
Last question po.
I will update you on Wednesday. So out of the total of 313 PUIs, 183 are Filipinos. Yung Chinese are 99, and then the others are all the other nationalities. So mas marami na talaga yung Filipinos kasi nga sila yung mga nakasabay sa aeroplano, nakasabay sa mga sasakyan, tas sa hotel, tsaka sa hospital nung na-admit.
Okay, for the very last.
No local transmission yet. And in fact, we have still no negative. We have 109 tests that turned out to be negative and no additional positive tests. So there's still the 3 imported cases.
For the last question po.
I don't have that data yet, Sheila. We will, kasi we don't segregate it, eh. Hindi naman namin iniwalay, for example, kung Hong Kong, Guangdong, which just really all travel from China.
Okay, thank you.
Last question, Trish. We're still not immigrate. Ito yung we're still verifying that report of 13 immigration officers. I also heard that, but we're still verifying that report. Sa mga naka-quarantine sa loob ng Clark, there are no immigration officers. There was no contact with immigration.
Okay, thank you very much. So that concludes.
Sige la. Meron the advisory. The advisory was really directed at mass public gatherings that are very difficult to control. No? For example, concerts na maraming tao, tas masikip, tas hindi naman natin alam kung sino yung mga nandun, or mga big prayer rallies or big mass gatherings. So the DOH recommends to maybe postpone or cancel these events. But for example, of course, gatherings na mga well-controlled naman and you can take precautionary measures, you can always push through with them. And these are always just recommendations. No? It's not like it's illegal to hold a meeting or to hold a convention, especially if you can take precautionary measures. Yun talaga yung initial next, the big mass gatherings.
But the risk is high. These are
Well, kasi yung talagang very close contact, we all know that the known transmission is droplet and close contact. And when people are together and you don't know where everybody came from or if anybody has any illness, there's always that risk. And it's greater pag mas magkakadikit at saka mas kulang tayo ng precautionary measures. Iba naman yung convention, halimbawa ng mga nurse o ng mga doktor na pwede silang maglagay ng mga dispenser ng hand sanitizer, and then of course yung mga nakaupo naman sila na hindi naman masyadong masisikip.
Okay, thank you very much. So that concludes our Monday press briefing. Our next press briefing would be this Wednesday. Time to be announced. So thank you very much, and please do visit ncovtracker.doh.gov.ph for the live, up-to-date and real-time tracking of our cases. Thank you very much.